Hi, Katie here. Thank you for joining me today for this video over active cycle breathing techniques. Today we're going to go over 3 different breathing techniques that are extremely helpful for patients with thick, sticky secretions, mucus, sputum, whatever you want to call it, in their airways that have a difficult time expelling them or getting it out. These techniques are especially good for patients with COPD, bronchiectasis, cystic fibrosis, anybody that has problems with thick and sticky mucus or secretions. So there are 3 different moves for the active breathing cycle technique. So the first one we're going to go over is deep breathing with diaphragmatic breathing. So we are going to sit up nice and tall in our chair. We'll put one hand on our chest and one over our belly button. What we're going to do is breathe in through our nose and purse lip breathe, pucker them up, and exhale out our mouth. Just like that. So I want you to focus on your hand over your belly button. When you inhale, you should feel your hand coming out. So let's try that from the side. When you inhale, exhale, your hand comes back in. We'll do 3 more of those. Inhale. Notice my top hand is not moving. Only the bottom hand is coming out. We don't want our top hand to move. That would mean we're breathing with our upper chest muscles. Our lungs do not exchange oxygen up here in the upper airways, only in the bases. So it's better to have one hand down here to make sure you feel your hand actually expanding out, so you know you're getting that good diaphragmatic breathing, oxygen to the bases of our lungs. Okay, the move we're going to do is the thoracic expansion technique. So what we're going to do is place both hands on the sides of our rib cage, right here, or our ribs. When you inhale through your nose, we're still going to exhale with pursed lips out our mouth. When we inhale, when you normally have your hand over your belly button and you inhale, you feel your hand coming out. You should feel the same with your rib cage on the side. When we inhale, a nice big breath, you should feel your hands on the sides of your ribs expanding out just slightly and coming back in on exhalation. We're going to do that about 5 times. So inhale. Inhale, feel our hands coming out. Great job. All right, now for the last maneuver, we're going to do some forced expiratory exhalations, or also known as huff coughing. So we're going to sit up nice and tall, and you're going to inhale through our nose. And when you exhale, you're going to make sure you make a huffing sound, forcefully exhaling it at least twice all the way out. So it will look like this. Exhaling, making a huffing, forcing that air out to come out of your airways. We're going to do it about 5 times. Breathing in through our nose. Good. Almost sounds as if there's a slight wheeze when we're exhaling. So the reason for the huffing sound, we take a deep breath in through our nose to get air into our airways, trying to get it behind that mucus, and then the huffing sound creates a type of vibrating and helps to move the mucus centrally towards our central airways and helps to loosen them up, so hopefully you're able to cough and expel out that mucus. So that is it for today's video. Thank you for joining me. I hope you enjoyed it, and we will see you again soon. Don't forget to keep breathing and keep moving.